If you've already got ants in your pants after a few days in isolation, it may be some comfort to consider the morbid alternative. Researchers at Auckland University say that without intervention or preventative measures, as many as 80,000 New Zealanders could have died from Covid-19. But what impact has a full lockdown had on those projections? Auckland University's Professor Sean Hendy is with us this morning. Tēnā koe, Sean.
Morena, Jack.
83 cases confirmed yesterday. So that's 2 fewer than on Friday. Can we read anything into that?
I wouldn't want to read too much into it. I mean, what we're seeing at the moment, and this was expected, is we're seeing a lot of cases that are still related to international travel. And of course, those travel restrictions, they were tightened 2 weeks ago. And so we're expecting to see, those cases related to international travel start to drop, especially this week. So they'll start to fall out of those statistics. And we do expect a drop or a plateauing in numbers. What we're really concerned about, and what we're watching as modelers, is what about those clusters of community transmission? Those are the ones that have the potential for the exponential growth that we're seeing overseas.
And what does the data tell you about the capacity for that exponential growth? How bad could things be?
I mean, it could get very bad. I mean, the 80,000 figure, that was kind of the worst case scenario that we were looking at. We're not facing that now that we've taken these steps, but we still have to be, it's still a possibility that we could have tens of thousands of deaths. But given the steps that the government's taking, given the lockdown that they're taking, that's reducing the possibility of that happening all the time.
How much is it reducing that possibility?
One of the things it does when we go into lockdown like this, I mean, basically the way it works in our models is, there's a number called R0, and that's, if you get infected, on average, how many other people will you infect? And by going into lockdown, us keeping to our bubbles, we're protecting ourselves by not having contact with other people who might be infected. But also, if we do get infected, then we're reducing the number of people we might go on to infect. And that number, we want that number to get below 1. So on average, right, every person is infecting less than one other person. And if we get that, then what we will see, we'll actually contain and be able to eliminate the disease in New Zealand. So that's the number we're looking for.
Now, I'll make it clear, so you don't have to. You are not an epidemiologist or a virologist here. You are looking at the data. But from the data sets you have available to you and the current state of the New Zealand response, how many deaths are likely in New Zealand?
It's still really up in the air. I mean, one of the things that we've got, it's a new disease. So, and, we are working with people who are clinicians, who are epidemiologists, and they're working really hard to understand the international literature. What is the information we're getting from overseas that tells us that, the characteristics of this disease? So we're kind of learning as we go about that. And then also, how are New Zealanders responding to the lockdown? Are we actually staying at home? And it looks pretty good in Grey Lynn. People seem to be following the physical distancing here where I live. But we'll have to get a sense of how that's going in the country. So the scenarios are still really broad. I mean, it could just be a handful of deaths. We've got several hundred cases now in New Zealand. We know from what we've seen overseas that means there will likely be some deaths as a result of that. And so if our tracing and testing regimes are strong enough, then actually that will really restrict those numbers. If not, then these lockdown measures will have to go on longer, and we're still facing a scenario where we might have thousands of deaths. But we've got some control over that by how long these lockdowns last.
Is the Ministry of Health doing enough testing to give you the data you need?
We're just getting that starting to come through now. So that's really going to be our number one thing we're going to be working on this week is to start incorporating that into the modelling, and we should be able to say something about how effective our testing and our contact tracing is sometime this week. Just
to be clear, though, is that a delay in the communication of the data points from the Ministry of Health to your team, or is it that the Ministry of Health isn't doing enough community testing yet?
it's actually the disease itself, really, because there's a lag, right? There's an incubation period that's actually quite variable for different people, and so actually we've sort of we've got to look at that data, and everybody has to remember that the numbers that are being announced every day, right? Some of those people were infected up to 2 weeks ago, and so there's this lag effect that just means that from a statistical point of view, we have to wait for a certain amount of time before we can really understand what the disease is doing in New Zealand. I
appreciate these are early days, but from the data you have at the moment, do you think we'll be coming out of lockdown in 4 weeks?
I wouldn't want to make a call at this stage. I think it does really depend on how well we're sticking to things. I mean, people should prepare themselves for a longer lockdown. I mean, it's certainly a possibility that we might have to have longer lockdowns. I think the other thing is that we're considering whether we might be able to maintain regional lockdowns. So that's something that people should think about as well. The possibility that some parts of the country may come off level 4 earlier than other parts of the country. In particular, if we're able to contain and keep the disease out of certain towns, certain regions, then they may be able to lift their levels earlier.
And this would be a response to the clusters that you referenced.
That's right. So if we can keep clusters out of parts of the South Island, for example, or parts of the North Island, then maybe we can ease restrictions in those regions. I mean, you still would have to have controls on whether people can come in and out of those regions. So there'll still be restrictions, but it maybe you can go, say, from level 4 to level 3 a little bit earlier than other parts of the country.
Is this our future until we get a vaccine? Is that what the modelling tells you at this stage?
Yeah, look, even if the next 4 weeks goes to plan, and I think we've got a good plan in place. Even if that goes to plan, the reality is it's got out of control overseas, and that wasn't within our ability to influence as a small country. Other countries have let it get out of control, and that makes it quite dangerous for us, even if we can keep ourselves safe here and eliminate it here in the next 4 weeks. So people should anticipate, international travel restrictions for quite some time until we have that vaccine, right, which would then protect us if we were to go travelling overseas, or allow people to potentially come here if they've been vaccinated, or potentially antibody tests, right? So there are a number of antibody tests that could actually the blood tests that can check whether you've been exposed to the disease and whether you have immunity. And so if those kind of testing regimes become widely available, that might allow us to ease some of those international travel restrictions. But we have to do what we can to keep it out, once we've eliminated it within New Zealand.
Professor Sean Hendy from Auckland University, it is always so good to speak. Thank you very much for your time.
Good to talk to you too, Jim.
The latest Ministry of Health statistics show that New Zealand has 83 new cases of COVID-19. So our confirmed total, is now 451, with 2 people in intensive care. We've been warned those numbers will continue to increase in the coming days. Health Minister David Clark joins us live from Dunedin. Tēnā koe, welcome to Q&A.
Good morning,
I want to begin
Jack.
with the lockdown. What is success? In 3 weeks' time, what is the criteria for lifting the lockdown and reducing our alert level?
Well, ultimately it will depend on the clinical and scientific advice that we're given. Every New Zealander has a part to play here. We're all in this together. If we see that curve starting to bend, if we can see that the intervention is making a difference and that we are starting to see the numbers come under control, we'll take the advice that the experts bring to us. We've got an alert system with 4 levels in it, and so that gives us the ability to ramp up or ramp down as we see the situation change.
So what if the experts told you we need in terms of numbers? How many new confirmed cases do we need to have before we lower that alert level?
Look, we haven't got into specific numbers in that regard. It really depends on the rate of increase and whether we're seeing that curve bend, whether we are seeing New Zealanders observing the social distance, whether we're seeing the behaviours we know will change the nature of the outbreak, and also whether we're able to track the cases, whether the new cases that we're getting are ones that have come in from overseas that we can clearly explain, or through close contact, or whether we've got evidence of some wider phenomenon going on.
How much does it need to bend?
Look, it needs to bend significantly from where we are right now. We're seeing case numbers increase, as you highlighted at the beginning of your report. And that's what that's the reason we're in this situation where we're asking people to stay home and stay safe, because we know we need to change that trajectory.
Do New Zealanders need to prepare themselves for the likelihood that this lockdown could last for longer than 4 weeks?
Well, I think ultimately it's in our hands. If people do take the actions, I've seen people heard reports of people playing touch rugby or going into businesses that are non-essential. That cannot continue. We have zero tolerance for that kind of thing going on. If people do those kinds of things, we will need to stay in lockdown longer, because that behaviour affects all of us. So we're asking every New Zealander to play their part, to do all of the things that are required, the public distancing, going to the supermarket, sending only one person to do that, washing your hands frequently, but just staying home. If you're unwell, staying home completely, getting someone else to bring you your shopping, or sending someone else in the household to get some shopping. If in doubt, don't go out.
I look overseas to countries such as Spain, where of course the outbreak is much more serious than it is in New Zealand at the moment. In Spain, you can't go out for anything. Is that the sort of restriction you might consider if New Zealanders don't abide by the rules as they stand?
Look, the scientific evidence, the medical evidence is that if people abide by the rules we've got, we will see that curve start to bend. So we don't want to put unnecessary hardship on people, but we ask people to observe the things that they've been asked to observe. In the interest of all New Zealanders, it's about staying home, staying safe, and ultimately that will save lives. And
does the evidence and the data that you have suggest that the curve will bend sufficiently for us to lift the lockdown after 4 weeks?
Well, the modelling scenarios we've seen, and they're not predictions, but they're scenarios, do indicate that with these kinds of behaviours, from what we know of infectious diseases, we should start to see that curve bend sometime after 10 days.
Have we got enough protective equipment and COVID swabs to supply general practices, community-based COVID-19 assessment centres and hospitals?
I'm assured that we do, yes. We've just sent out 640,000 masks. We've got another 4 million going out to health workers in the next month, 4 million going out to other workforces that are non-health related, and we've got production ramping up in that regard. We've got supplies of PPE of different kinds. The important thing will be making sure we continue to get it. We've got these stocks in reserve for a reason, for exactly this kind of situation, and we're working very hard. The whole of government's very focused on making sure we continue to get the stocks we need into the future.
Why aren't community care workers getting facial masks?
The Ministry of Health has updated its guidance on who should have different types of PPE in the last 24 hours. So I'd encourage people to go to the website to see what's required. But of course, it depends on the kinds of care and the kinds of contact people are having. And that is something that's being worked through closely with each of those organisations. Yeah,
but back to my question then. These are community care workers who care for 100,000 elderly and disabled New Zealanders. If you and I can't stand within 2 metres of one another, how can we expect these workers to go into people's homes and assist them with lifting and cooking and that sort of thing without facial masks?
Well, I mean, my understanding is that if they are up close in certain situations, then it is appropriate, and in other situations, it's not. Now, that is being guided by clinical decision makers, those who understand the science. And so my concern is if people do have concerns about that, they should be talking through WorkSafe and addressing those concerns.
I'm looking at the guidelines that you have published within the last 24 hours right now. So people who, for example, are immunosuppressed don't even get gloves if they're going to assist people in a community care space.
Well, look, these are the bits of advice that we have been given. Those things are constantly being revised. We are looking at the best evidence on what works and on how to keep people safe. Remember, these people are being kept in a bubble. So we are, this is again the reason that all New Zealanders need to observe the social distancing requirements.
Sorry to interrupt, these community care workers might be assisting 8 people per day. So that's a significant bubble. And again, if you and I aren't allowed to get within 2 metres of one another, but these people are going to 8 different homes throughout a day, plus being in their own home, in their own bubble, surely that presents a significant risk. And we're not giving them masks or, in some cases, gloves.
Well, I understand that they do have the gloves when they need them. And this is, I can only go off the clinical evidence, the scientific evidence. That's what served us very well, by making sure we have the PPE stocks where they're needed, when they're needed, to keep people safe. We do have enough PPE, and the challenge, you will have heard some anecdotes, I certainly have over the last week. At times it's not in the right places at the right time. That is what we're very focused on sorting out so that we don't have those cases where it's not where it should be.
Are there plans for the redeployment of GPs, doctors and staff if general practices remain quiet in the coming weeks and the demand on acute services increase?
Yes, we are looking at different ways of operating. General practice is seeing a huge change in the way it operates, and some of them are coming under financial pressure as a consequence too. That's something the government's very alert to. We want to make the most of those workforces and support them to support us through this. Again, they're critical in this, but all New Zealanders doing the right thing, staying home, staying safe, will take the load off all of those health workforces.
So GPs might be called in to help. What about medical students?
Well, we'll look at all workforces as appropriate along the way. We've had a lot of people who have trained in health areas who have been deployed in other fields of work, which are deemed now non-essential, putting their hand up to come back and serve in the health field too, as well as those retired folk. And we know there's potential to use tools like you and I are using right now, Jack, the Skype and other things to make sure that they can keep a distance from patients if they're elderly or retired, but provide valuable medical assistance.
Are tents being sent to hospitals so they can establish outdoor triaging centres?
Each DHB is doing its own response. We've got some community-based assessment centres set up around the country, about 40 of them, I'm told now. We have DHBs looking at where they can have additional capacity should they need it for overflow. But the majority of space we have already. It's about repurposing it. For example, making sure that ICU-like conditions can be set up.
Yeah.
DHBs will make those decisions in their own situation in order to meet the needs of their own.
But what's the information
they're not being? I don't understand that they're being centrally sent out. The DHBs are each making their decisions as to how to best serve their communities.
You mentioned the financial pressure on GP practices. Is there anything the government can do to assist in that space outside of redirecting GPs into the acute response?
Yes, we're certainly looking at financial response to support them. We've put aside money, if you recall, in the health package that was announced alongside the early financial package from the Minister of Finance. So there is finance there to support our primary care workforce, and we're looking at how we can release that.
Minister, are you able to give us any update on the Nelson patient who was in intensive care?
I don't have patient details, and for confidentiality reasons, I wouldn't expect to. But, we need to be prepared that we will get some sick people here. New Zealand is not immune. We will see some deaths. But again, it's up to all of us to make sure we're doing the right thing to ensure that we don't face the situation that they are facing in those hotspots overseas. Minister,
why are you in Dunedin and not in Wellington?
Basically to keep people safe, in the same way that you're there and I'm not in the studio with you. As ministers, we've decided that the important thing is that we are doing exactly what we expect of everybody else, making sure that we are staying home, staying safe, and thereby saving lives.
Why wouldn't you isolate in the capital, though, so that if some of your colleagues were to fall ill, you could respond and take over?
Ultimately, we're all doing this stuff by distance. So I have to say I've got a phone taped to my ear all day, pretty much at the moment, and working some long hours. But lots of people are in this response. That's not unusual. It's good that we live in the internet age where we can communicate via a range of medium and keep the system moving.
Health Minister David Clark, good luck. Tēnā koe. Thank you for your time.
Thanks, Jack.
I just want to let you know, for the duration of the lockdown, I'm not going to be doing any interviews in person in the studio. It will mean some subtle differences in the style of interviews that we conduct on Q&A. And although Skype isn't perfect, as you saw then, it's not half bad. And the upside is that you will get to have a bit of a nosy in some of our guests' homes.
Sadly, New Zealand has had its first death linked to Covid-19 on the West Coast early this morning. The death was in a woman in her 70s who had initially been admitted for what was thought to be influenza, complicated by an underlying chronic health condition. As we have seen around the world, Covid-19 can be a deadly disease, particularly for older people and those with underlying pre-existing health conditions. All of our thoughts are with their family and loved ones at this time. As a result of the initial diagnosis of influenza in this person and the subsequent confirmation of COVID-19 a couple of days later, there was a period when staff treating the woman were using protective equipment suitable for influenza but not for COVID-19. Once the diagnosis was confirmed, staff undertook a range of measures to protect both themselves and other patients. But as a precautionary approach, the DHB has placed 21 staff into self-isolation for the balance of the 14 days since they last had contact with this person. Understandably, the family would like to take time to grieve, and they have asked the media to respect their privacy at this time. Our health system will continue to do everything it can to help patients with COVID-19. We have sufficient hospital capacity to manage our current and projected cases, and we have plans well in place to boost capacity if needed. This latest sad news reinforces our move to Alert Level 4 and the measures we are all taking to prevent spread, break the train of transmission and prevent deaths. There were 63 new cases of COVID-19 in New Zealand overnight until 9 o'clock this morning. That is made up of 60 new confirmed cases and 3 probable cases. I can also confirm that there are now 56 people who have recovered from COVID-19. We currently have 9 people in hospital with COVID-19. There are 3 in Wellington Regional Hospital, 1 in Waido Hospital, that's in Blenheim, 1 in Nelson Hospital, 1 in Whangarei Hospital, 1 each in Waikato, Taranaki and Dunedin hospitals. One of those people is in ICU on a ventilator, and for privacy reasons we won't be providing other details on these patients. Our labs continue to process and report test results as quickly as possible, and over the last 7 days the average daily test numbers was 1,786. A reminder that anyone who has been tested for COVID-19 is expected to be in careful, close self-isolation, including from their family members, until the result of that test is made known to them. We are still seeing a strong link among our cases to overseas travel, as well as links to confirmed cases, and we continue to investigate several possible clusters. Details about the new cases will be provided on our website as they become available, as well as any clusters that we are investigating. So the combined total of confirmed and probable cases in New Zealand is 514. Today, a reminder to you that we are seeking physical separation, not social separation. Be supportive, reach out to people, and most importantly, be kind. And finally, as Wellington Hospital Intensive Care Specialist Dr. Paul Young said today in the media, if New Zealand pulls together as a community and stays at home, you will save more lives than I will in my entire career. Thank you. Over to you, Prime Minister.
Thank you, Director General. Good afternoon. As you've just heard, we have had our first death from COVID-19. And I know the thoughts of everyone from around the country with the family of this person. This will be an enormously difficult time for them, and I do ask that we respect their privacy as they grieve for the loss of their loved one. It is a very sad day, but it also brings home exactly why we are taking such strong measures to stop the spread of this virus. Left unchecked, it runs the risk of taking the lives of many more people. Even with the measures we now have in place, we will continue to see more people get sick because of the time it takes for people to become unwell after they have picked up the virus. Our older New Zealanders and those with underlying health issues are by far at the most risk. It is critical that we all stay at home to give our older New Zealanders as much protection as we possibly can. And our shield of protection for these people is physical distance. But as the Director General has said, that doesn't mean we cannot be there for them in other ways. Keep in touch on the phone or via Skype. Do all you can to help keep their spirits up without coming into physical contact, whether it's dropping food at the gate or leaving messages. Today's death is a reminder of the fight that we have on our hands, and it's a reminder of why it is so important and everyone can play their part through the simplest of tasks by not having contact with people outside of your bubble. Stay at home, break the chain, and save lives. I also want to re-emphasise the need for kindness and support for those who have had or currently have COVID-19. After hearing reports of comments online that I would say amount to bullying, this virus could affect any one of us and any one of our loved ones. And I know that if we were in that position, it would be difficult enough without having to face the unjustified judgment of others. There are 514 people who are or have battled this illness, and they deserve our support, just as we would for anyone who is sick and in need. I also want to touch on enforcement issues. I have seen, as you will have, reports of New Zealanders not following the rules of the lockdown. And this group we can all rightly feel very frustrated with. I spoke with the Police Commissioner this morning, who has confirmed that the police have all of the resources they need. That includes the power to arrest and detain if needs be. No one wants that. So I ask that people follow the rules in the same way that the majority of New Zealanders are. Many Kiwis I know are keen to ensure that collectively the rules are being followed. Some are trying to encourage that by calling 111. In fact, over 2,000 calls have been made in order to have the rules of self-isolation enforced. Police have today launched a new online form which the public can use to report level 4 restriction breaches. The online form can be found at 105.police.govt.nz. It can be used to report isolation breaches or cases of businesses continuing to operate when they are not part of the essential workforce. The Police Commissioner has urged people to use the online form instead of calling police. That enables them to triage those calls which are most critical and most urgent, whilst also giving people the ability to share where they have concerns that people are not following the rules. We know people want to do the right thing if they see people flouting the restrictions, but this enables us to ease non-emergency phone use. Police will take the information reported online and make contact to remind those breaching the restrictions of their responsibilities. Finally, the COVID Cabinet met this morning to discuss our border measures and the management of New Zealanders returning from overseas. Yesterday, 840 roughly people arrived back in the country, primarily from Australia and the Pacific, and it's expected that roughly 300 will arrive today. These numbers have been falling dramatically following an initial influx after the lockdown was announced. As you recall, we have stepped up the requirements at the border, and anyone who is symptomatic or does not have an adequate self-isolation plan are essentially quarantined. I know this is causing concern for their families, and I do acknowledge that concern. We have to keep in mind, though, that returning New Zealanders, through no fault of their own, do carry the greatest risk. We continue to work through ways to manage this risk and meet the needs of returning travellers as best we can.
Forced hotel quarantine for all overseas arrivals comes into effect at midnight. Let's go live now to Kari-Anne Greenbank, who's at Melbourne Airport tonight. Kari, when are the first passengers due?
Well, Alicia, after midnight, the first international flight isn't set to arrive until around about 6 o'clock tomorrow morning. But the Premier says that tomorrow we should see between 1,000 and 1,500 people arriving here in Melbourne from overseas. He says expect a similar number every day for the next little while at least. From this point, everyone arriving and walking through these doors will be taken straight to hotel quarantine. And we've been told that there's around 85 Sky buses on hand to take people to their destination.
There we go. Welcome to your new home.
Step inside a standard room at the 4 Points in Docklands and you'll get some insight into what quarantine will be like for our return travellers. There's a bed, desk, view, pay TV and plenty of time to watch the clock for the next 2 weeks.
We'll be providing 3 meals a day to them, similar to what you would eat at home during the normal week.
The mandatory lock-in comes into force from midnight, where anyone flying into Melbourne Airport will be escorted to a Sky bus and driven to a hotel, where Victoria Police Police, private security guards and Australian Defence Force members will make sure they stay in their rooms for 14 days. 2,800 hotel rooms are being held for return travellers tonight, with thousands more being offered up right across the state.
Effectively, we almost have 100% of our hotels' occupancies right around the country to be able to utilise.
From this point on, anyone flying in from overseas will stay in one of these rooms.
If you are from another part of the country and you land in Melbourne, then you will be quarantined in Melbourne.
Hotel bosses say there are safety procedures in place to protect staff, like leaving food at the door and getting those in quarantine to change their own sheets. But for many at 4 Points who lost their jobs just days ago, it offers a financial lifeline and a glimmer of hope.
It's vital. They have to feed their families, and they've got friends and parents and loved ones and children. And I'm sorry.
Curry-Ann Greenbank, 9 News.
The number of patients who've died from coronavirus in Sydney has risen. A fourth elderly resident of a Macquarie Park aged care facility passing away today in hospital. But our main source of the spread continues to be travellers returning from overseas. And from midnight, they will be quarantined in hotels guarded by the military.
Welcome to the Novotel, Darling Harbour,
where we have to stay for the next 14 days. This is our hotel room, a lovely view with the police on guard.
Nicole is a cruise ship crew member. As a high-risk traveller, was taken into forced quarantine early. Last night, she says, Sydney Airport was chaos.
It's been 13 hours since I've been able to eat food, or over 13 hours now.
The new arrangements causing tension for some.
You need to stay in your room. What's your name? My name is Constable Kramer from Sydney City Police. Hopkins. This is how we're being treated. This is how every police officer is out on the street. Stay in your room.
The Commissioner making no apologies for using the full force of the law to try to stop the spread.
I know it is challenging times for those people returning home, and at times perhaps the food isn't up to standard, or they feel as though the bed's not as comfortable as their own.
These passengers leaving LAX were told of the government's new powers.
Just been told that I have to stay in Sydney for 2 weeks in quarantine, and then I'll be able to go back to Darwin.
They'll all be health checked at Sydney Airport before they're bussed to hotels.
You stand, you got checked, you got your temperature in both ears.
People will have to stay in their hotel rooms. No gym visits, no restaurant meals, and if they have any symptoms, they'll be taken to hospital. The hotel bill picked up by taxpayers. The Premier saying things may get even tougher.
New South Wales is looking at stricter conditions in relation to people's activity if we don't feel comfortable that the decisions we made last week are making a real difference.
Along with police, the military is also being called in to enforce these new orders. They'll be patrolling the quarantine hotels. Members of the Australian Defence Force will also be turning up at people's homes for spot checks.
They're not criminals, they're decent Australians returning home. We will treat these people with absolute respect.
Since yesterday, New South Wales has recorded 212 new cases of the virus, taking the state's total to 1,617, including 8 deaths. Among the new cases, an Ashcroft High School teacher who attended school for 1 day while infectious but did not teach classes, and a 2-year-old child and a worker from a Sydney childcare centre. A 91-year-old woman died in hospital this morning, the 4th resident of the Dorothy Henderson Lodge at Macquarie Park to succumb to the virus. 13 elderly residents have so far tested positive. Some good news tonight. 3 have recovered and are no longer in hospital. For now, this and many hotels across Sydney, for the 14 days of quarantine, you can't check out and you can never leave.
Ready for some sleep and hoping I can get home soon.
Lizzie Pearl, 9 News.
More than a dozen Sydney hotels will be full for the next fortnight at least, as thousands of Australians arriving on home soil are placed into quarantine regardless of their health. Laura Tunstall is at Sydney Airport, and Laura, buses to transport incoming passengers are ready and waiting.
They sure are, Georgie. You can see them lined up behind me. These buses are actually waiting for 2 flights which are landing this evening from Doha. And passengers on board those flights who are deemed to be at risk of coronavirus will be bundled onto these buses this evening and taken straight to a hotel. Of course, this will be mandatory for all travellers arriving here at Sydney Airport as of midnight tonight. They'll have their health assessed, their temperatures checked, and if they are well, they'll be taken straight to a hotel. Now, the Army is expected to bring in more buses tomorrow to help facilitate this. This operation is being run by the New South Wales Police Force. Up to 15 hotels across Sydney are expected to be needed. They will be providing their kitchens, their staff, to be able to provide meals for these passengers. Now, anybody who is quarantined will have to stay in their hotel room for 14 days, Georgie.
Laura Tunstall, thank you.
Italy has set another record for the most deaths from coronavirus in a single day. Nearly 1,000 people have died in the past 24 hours. That brings the total death toll to more than 9,000. That's the highest number of any country, and health officials say the worst may be yet to come. Hospital wards are still full, although doctors say the number of patients is now steadying. Contagion rates appear to be slowing as well, giving hope that the strict social controls in effect may be working. But the lockdown is hitting the Italian economy hard. Churches and charities are struggling to care for people in need of basic supplies. All right, let's bring in journalist Seema Gupta. She's following the situation from Rome. Seema, first, of course, just let's talk about that shocking number, nearly 1,000 people dead in just 24 hours. Is there a sense that Italy is now approaching perhaps the peak of this crisis?
Well, Carl, what the officials are telling us is that Italy is not near the peak. It is not in the declining phase. In fact, we heard from the representatives of Italy's National Health Institute, and they say the only thing they can point out in terms of a slight light at the end of this dark tunnel is that the curve of contagion appears to be slightly flattening, especially since the 20th of March. And they believe that that is a good sign. Now, the president of the Lombardy region, that's the hardest hit region that saw some 50% of those deaths that we saw in that one day, close to 1,000, that massive figure. He said that the region may see a decline in the next few days. It's hard to understand how these figures work when you see such massive numbers. But what's clear as well as the members of the Institute of National Health have told us, it's inevitable that the lockdown period at least will be extended beyond that 3rd April date that was set.
Earlier in this crisis, we'd seen these uplifting videos of Italians singing from their balconies. What is it like there now? I mean, how difficult is it to keep that sort of spirit going in Italy?
Well, Carl, those flash mobs seem to have stopped. I mean, just dealing with these depressing figures, it's just hard to grasp the immense nature of this tragedy. You're talking about figures that could be a small village, an entire village being obliterated just in the space of 24 hours. It's absolutely heartbreaking. I think some Italians, maybe even many Italians, found some solace perhaps on Friday when we saw Pope Francis go to St. Peter's Square and give this prayer to help those that are suffering and to pray for an end to this pandemic. It was very dramatic, those images of rain pouring on what was an empty St. Peter's Square, and the Pope Francis standing in the middle praying for this. At the same time, it's those healthcare workers that are in the front line fighting this battle. We know so far 46 doctors have died as a result of COVID-19, and more than 6,000 healthcare workers are infected.
Yeah, they are the ones, of course, on the front lines of the pandemic. Seema Gupta for us in Rome. Thank you for your reporting.
When it comes to social distancing, the Pope is leading by example. Just a few scattered visitors follow the Pontiff's prayer service from afar at St. Peter's Square. He compares the pandemic to a storm that has hit almost the entire globe.
For weeks now, it has been evening. Thick darkness has gathered over our squares, our streets, and our cities. We feel it in the air, we notice in people's gestures, their glances give them away. We find ourselves afraid and lost.
impauriti e smarriti.
A fear that the Pope himself likely shares. 5 cases of Covid-19 have been diagnosed in the Vatican so far. One of them reportedly inside the papal residency.
We
have realized that we are on the same boat, all of us fragile and disoriented, but at the same time important and needed, all of us called to row together, each of us having to comfort the other. On this boat, we are all together.
Su questa barca ci siamo tutti. Tutti.
After his address, Francis went on to perform a world premiere. He delivered the Urbi et Orbi blessing that is usually saved for holy ceremonies, Easter and Christmas. It is the blessing to the city and the world, even though this time almost no one was there to receive it in person.
In the United States, more than 100,000 people have been infected with the coronavirus. That's more confirmed cases than in any other country. But according to health experts, the country needs to do more to reveal the extent of the outbreak. To help achieve that, the U.S. Food and Drug Administration has approved a new rapid test from Abbott Laboratories. The company says the test can detect the coronavirus in about 5 minutes and is so small, the size of a toaster, that it can be used in almost any healthcare setting. It plans to supply 50,000 tests a day starting April the 1st. And to look into this, I'm joined now by Dr. Eric Fagel-Ding, an epidemiologist and health economist at the Harvard Chan School of Public Health. Thank you for joining us, Doctor. Is this test for real? It almost sounds too good to be true.
It's definitely real, and the technology has evolved a lot in the last few years to make this possible. And I'm still waiting for it to see some of the accuracy measures, because I think those still have to be peer-reviewed and published. But any test right now is much better than the one we have right now, which takes almost a whole day turnaround and is only 30 to 50% accurate. So this test that is on a rapid scale can immediately tell people you need to be quarantined or not, would be infinitely better and faster in terms of helping us contain this virus than what we have now.
In January, experts were already warning this disaster could spread beyond China's borders, and you were one of them. Why did the U.S. not take this threat seriously?
Well, the U.S. was under a lot of other busy things like impeachment during that time. And I think sometimes it's really hard to imagine almost the apocalypse compared to what people can want to believe, because it is almost so hard to believe that we have this kind of global recession, depression upon us, and people being locked in their homes compared to what was just happening. And people don't want to accept that that is the reality. And oftentimes the governments are frozen, and sometimes they just want to, keep calm and carry on. But sometimes that is not what you need to do. Sometimes you need to activate getting the tests ready, getting masks ready, ventilators. All these processes should have been started months ago.
Okay, well, I'd like to ask you about President Trump, because he at first was saying this wasn't really a problem, and then suddenly he began to take stronger measures under criticism, most recently the $2 trillion bailout, which came from the Senate, and then telling General Motors to make ventilators. So that's all good, but has the government waited too long in the U.S.?
Yeah, it's initially him calling it a hoax or just corona flu and saying that, it's just a flu and you can still go to work with it was just the wrong thing. It was this is the first time in which misinformation came from the top, and it wasn't just a silly misinformation, but actually costed tons of lives. This virus previously had a doubling time of 6 days, which means, missing 3 weeks meant 200 cases becomes 4, becomes 8, becomes 1,600 cases. Within just a few weeks, we potentially missed 10x or 50x the number of cases and illnesses that we could have prevented had we moved faster. And this is failure in political leadership in the worst extreme. So, and now we have this pandemic on our hands, and it's obviously the fault of many governments who fail to react, and we're paying the price.
You were speaking of many governments being involved. How is the world? Sorry for interrupting you there. You were talking about many governments being involved. How is the world overall dealing with COVID-19, and can countries fix it alone?
Yeah, so in terms of vaccine production, vaccines will be the ultimate solution for it. But vaccine, unfortunately, is still about 1 year to 18 months away. Maybe we can find drugs that will work much sooner, within 5 to 6 months of ramp up. But all these kind of things takes international collaboration. And in terms of supplies, actually, Germany is actually the #1 source for reagents to conduct laboratory tests, in which we have a global shortage on. And all these supply chains, from masks and ventilators, all these things require global supply chains. And this is why the world has to come together, not get caught up in trade disputes and tariffs. This is the time for us to come together as a human race, to create a Manhattan Project to solve this epidemic before it kills millions.
A global problem requiring a global answer then. Dr. Eric Fagel-Ding, epidemiologist and health economist at the Harvard Chan School of Public Health. Thank you for that.
Over the span of 2,000 years, we have been given a collection of 66 books written by 40 people in various cultures, time periods, and languages. Today we call this collection the Holy Bible. Upon investigation, we find that these 66 books combine to form a message to humanity from a being outside of space and time by writing history before it happens. The Bible predicted the advent of the New Age movement and the New World Order thousands of years ago. It also tells us of a man who will rule this world empire and what his true intentions will be. All of this has been in the works for thousands of years, and it all hinges on Satan's ability to deceive mankind. The Apostle Paul in the 1st century AD wrote several letters to early churches, which are now called the epistles. The far application of these letters are a clear warning for us today. It is a warning of impending deception that will influence the whole world. Paul warns us of this deception in Ephesians 5, where he states, "Let no one deceive you with empty words." Then in his first letter to the Corinthians, he again tells us, "Do not deceive yourselves. If any one of you thinks he is wise by the standards of this age, he should become a fool so that he may become wise." In a letter to the Romans, he describes those who willingly live in lies when he writes, "Their throats are open graves, their tongues practice deceit, the poison of vipers is on their lips. For such people are not serving our Lord Christ, but their own appetites. By smooth talk and flattery, they deceive the minds of naive people." In a letter to Timothy, Paul clearly describes the world we see today when he writes, "The Spirit clearly says that in later times some will abandon the faith and follow deceiving spirits in things taught by demons." In the second letter to the Thessalonians, Paul describes the New World Order and the Antichrist when he wrote, "Don't let anyone deceive you in any way, for that day will not come until the rebellion occurs and the man of lawlessness is revealed, the man doomed to destruction. Don't you remember that when I was with you, I used to tell you these things, and now you know what is holding him back, so that he may be revealed at the proper time. For the secret power of lawlessness is already at work, but the one who now holds it back will continue to do so till he is taken out of the way. And then the lawless one will be revealed, whom the Lord Jesus will overthrow with the breath of his mouth and destroy by the splendor of his coming. The coming of the lawless one will be in accordance with the work of Satan, displayed in all kinds of counterfeit miracles, signs, and wonders, and in every sort of evil that deceives those who are perishing. They are perishing because they refused to love the truth and so be saved. For this reason, God sends them a powerful delusion so that they will believe the lie, and so that all will be condemned who have not believed the truth but have delighted in wickedness. The Apostle John, while in prison on the island of Patmos, had a vision of the end times and the deceiving entities that will walk the earth, stating, "And the great dragon was cast out, the ancient serpent who is called Devil and Satan, he who deceives the whole habitable world. He was cast out into the earth, and his angels were cast out with him. He deceives my own people who dwell on the earth because of the signs he was granted to do in front of the beast, saying to those who dwell on the earth that they should make an image of the beast who had the sword wound and lived." Jesus Christ himself gave his discourse of the end times when he stated clear warnings of the signs of the end. Watch out that no one deceives you, for many will come in my name, claiming I am the Christ, and will deceive many. You will hear of wars and rumors of wars, but see to it that you are not alarmed. Such things must happen, but the end is still to come. Nations will rise against nation, and kingdom against kingdom. There will be famines and earthquakes in various places. All these are the beginning of the birth pains. Then you will be handed over to be persecuted and put to death, and you will be hated by all nations because of me. At that time, many will turn away from the faith and will betray and hate each other, and many false prophets will appear and deceive many people. Because of the increase of wickedness, the love of most will grow cold, for then there will be great distress, unequaled from the beginning of the world until now, and never to be equaled again. If those days had not been cut short, no one would survive, but for the sake of the elect, those days will be shortened. At that time, if anyone says to you, "Look, here is the Christ," or "There he is," do not believe it, for false Christs and false prophets will appear and perform great signs and miracles to deceive even the elect, if that were possible. See, I have told you ahead of time. Jesus Christ died for the sins of all mankind. That means he died for the New Agers, the Freemasons, those in the Illuminati, the world elite, the Luciferians, the Satanists, and even me and you. God himself, taking on humanity, has given mankind a free gift of salvation and of true spiritual freedom. Now we all have a choice. We can live in darkness, allowing evil to enter our lives and unwillingly support the work of Satan and his fallen angels. Or we can let Jesus into our hearts and be spiritually saved forever. There are no prerequisites, rituals, or tests for accepting this gift of salvation. All one needs to do is ask honestly for Jesus to come into their heart. Remember these truths. God loves you, God cares about you, God wants nothing more than to know you personally and save you. Sin separates people from each other and God. Jesus died for your sins and rose again. You can receive Jesus now and know God's love right at this very moment. I pray for you all and hope the truth will indeed set you free. Thanks for your time. I think, in conclusion, I'd like to appeal to those people that have been researching this for any length of time, specifically long periods of time, maybe even years. To you, I don't think this is going to require a lot of convincing. I think that subconsciously you know that a lot of what was said here is true. I think that you have seen over the years a lot of conclusions about what the New World Order is and what their motives are. And I know that you know that it doesn't really explain all the loose ends and tie them all up. I think that you know, after kicking down so many doors in New World Order research and seeing those that truly expose the New World Order, this theme, that it is in fact theistic Satanism behind those doors. I know that you've seen that. You've seen that they are high-level occultists that really run the show and that are in the shadows. And that even those front men at the very tops are only front men, and that the real movers and shakers are those that hold very dedicated beliefs about the worship of Satan. So we even have this idea that somehow doesn't apply. We have a phrase that we'll say, which is, it doesn't matter what you believe, the fact is that they believe it, which sort of means, yeah, sure, they're all occultists at the top, but it doesn't really matter. They're just sort of deluded. And I think that's a very dangerous position, because if you actually are saying there that it doesn't matter, it's not actually true, there isn't really a Satan and there isn't really a power that they're serving, then we should just, again, think that this scenario has something to do with whatever we make it out to be. It certainly can't be about a cosmic war of good and evil, because we've already decided that that can't be true. Yet at the same time, we're pointing out that these people are knowingly worshiping Satan, which is something that the Bible has said has gone on from the very beginning. The kings and queens of all the old systems were always sacrificing their children to various gods and Moloch and these types of things. And they are still doing it today and are gaining power from it. The problem with believing that is it makes too much sense that all of this energy with the New Age preachers and teachers and truth movement icons and gurus are doing mainly two things. One, they're promoting this idea of a New Age coming in which you're going to be God and you're going to be evolved and all the obvious stuff that's preparing you for the system of the Antichrist. And the other part of that is they're telling you that Jesus isn't good, you shouldn't pay attention to him, or at least they're trying to misdirect you, tell him he's just this other guy, he's not really who the Bible says he is, or they're trying to discredit the Bible. There's only two things that these guys are doing. They're telling you and preparing you for the new system that you're going to think is your utopia. And then they're telling you to not pay any attention to the man that the Bible said would crush the one that these people at the top are worshiping. Does anybody see a problem with that? That we've been told what to think about the Bible and Jesus Christ by Satanists. The problem here is that what we've been told and what we've been prepared to believe is all what we would choose to believe. It's all very seductive. They're telling you that you can be as God. They're telling you that there is no real accountability for your actions, that anything that you want to do is good and normal and should be praised. These ideas are very difficult to resist. Truth really is irrelevant at that point, because we will fight to defend those ideas, regardless of if they are true or not. And that's why there's so many conflicting quote-unquote truths in the New Age and in the truth movement. You know, that's why the first thing that you're taught in the truth movement is that truth is relative. Oh, it doesn't matter, your truth is just as good as my truth, and we'll fight to defend this completely erroneous idea. I've got news for you. It doesn't matter what way the universe operates. The fact is that it does operate one particular way, cause and effect, in a closed system. We are dealing with absolute truth. Maybe yours, maybe mine, but it is absolute, and it is one. We should be concerned about looking for the truth. And I suggest to all you researchers out there that you already have enough evidence to know that Jesus Christ is who he says that he is. You owe it to yourself to figure out more about him the way the Bible says that he is. Not the way that the New World Order says that he is, but the way the Bible says that he is. The Bible has been continually discredited. You're told not to listen to it. You're told not to pay attention to it. They do everything under the sun to keep you from it. They always have. So why don't you just realize that and take the time and figure out who is Jesus according to the Bible?